So the first thing that you want to do is to verify your patient with two identifiers, name and date of birth. You want to go ahead and verify the provider's orders. Assess the patient for pain and allergies. If the patient is having pain, you want to administer pain meds before performing the procedure. You want to provide privacy for the patient. Let them know that we're about to perform wound care and prevention of infection and to promote wound healing. You want to ask the patient if they have any questions and also get a verbal consent from the patient that it's okay to do the wound care. So I'm going to go ahead and prepare my supplies on a clean surface. Okay, so the next thing you want to do is to make sure that the bed is at hip level so that you're comfortable when providing care. And I'm going to go ahead and perform hand hygiene and put my clean gloves on. So before we dress the wound, we want to go ahead, if there was an old dressing on this wound, we will want to remove that from the wound, and we want to assess for color, odor, consistency, and amount. We also want to make sure that the wound doesn't have any eschar, and we're going to check the wound for tunneling using a cotton applicator. This wound doesn't have any tunneling, but if it did, we will stick that cotton applicator into the tunneling and measure the depth of the wound, discard of the applicator in appropriate receptacle. Next, we're going to measure the wound. Okay, and also discard of that in the appropriate receptacle. Okay, I'm going to go ahead and remove my clean gloves, perform hand hygiene, and grab my PPE. And I'm going to leave my mask down so that you guys can hear me. So the next thing I want to do is to get everything ready for my sterile technique. And I'm going to put on my sterile gloves. Okay, now I'm going to get everything ready that I need to do my wound care. Okay, so next I'm going to take a 35 to 60 milliliter syringe and draw up sterile solution to clean the wound. I'm going to take a gauze and place it under the wound while I'm irrigating it. You want to irrigate the wound from top to bottom, and you will continue irrigation until you receive clear fluid. Okay, we're going to dispose of that in the appropriate receptacle. I'm going to take a clean gauze and pat the wound dry. I'm going to discard that in the appropriate receptacle. And the next thing I'm going to do is to take my wet gauze and my cotton applicator and pack the wound. Discard an appropriate receptacle. I'm going to take another gauze and place it over the wound. And I'm going to tape that down. Once we have that taped down and secure, I'm going to take my label and I'm going to label the wound, and it's going to include my initials, the date, and the time that wound care was provided. I'm going to go ahead and remove my gloves. Hand hygiene. I'm going to reassess the patient for any pain. Ask the patient if they have any questions. Lower the bed to the lowest level. Make sure that the bed is locked, and provide my patient with the call light in case they need any assistance. Go ahead and perform hand hygiene, and this completes my wound care.